Hello, I'm Koremasa Hayama from Nihon University. I'm an associate professor. One of my specialized area is Hidradenitis Suppurativa. In Japan, unfortunately, it's not so famous disease, but many patients come to our hospital. Their quality of life is very impaired. I want to make some algorithm for the patient. So what kind of patient are good for the biologics or something.
Sure. We'd like to thank you very much for your time today and all of the important works that you had mentioned. Before we started filming, I had said the same thing. You have spent a lot of time and resources to produce these wonderful sets of data that are so helpful for the world. And I wanted to let you know that we're reading from across the pond and that we're very grateful. And Jeremy is someone with stage 3 HS for the past 10 years. It's really important to us to see this work happening globally and us to figure out how we can help bridge the gaps, to use our platforms to help share your message and all of the people doing what they're doing to bring HS more awareness. So thank you again. Arigatou gozaimasu for your time. Thank you. So I have a series of questions today that I've spent time synthesizing with your published works to hopefully be informed and not waste your time getting specifically to some of the issues. They're grouped in 4 different areas. The first is just the HS landscape in Japan.
Yeah, okay.
First and foremost, I understand in Japan it's called, forgive me if I pronounce this wrong, I've practiced.
It's
Kanose kansanen.
Yes.
Okay, and this is how you refer to HS in Japan, or do you regularly say HS?
We call it kanose kansen, but kanose kansen is a little bit longer.
Okay.
So sometimes we call it HS. And maybe so recently, medical students know what is HS because they run in the medical school now.
Okay, that's good to know. And how many patients with HS do you treat here?
How many?
Or just a generalized, is it a lot, a little, hundreds, 10?
I have almost 30 patients per month, but every week I have many new patients because they want to ask me it's a new therapy here, or many patients are so afraid of their therapy now is right, or maybe so they want better therapy.
Better therapy, okay.
So in Japan, it's so-called second opinion.
And do you find a majority of the patients coming to see you are males? Or is it a mixture?
No, so I think that in Japan's patient is male dominant, but recently, so female patient is increasing. So I think it's because it just become famous in Japan now, but the female patients are ashamed to show their symptoms.
Right.
Yeah.
Thank you for bringing this up, because before we came here, we worried that we would somehow offend by asking if there were cultural sensitivities with females. We have a suspicion that the data is skewed because females just don't feel brave enough, perhaps, to say, or don't know what to call it, right?
Yes.
And so when I read through the data, it shows that predominantly males that affect their buttocks region have the most severity here in Japan.
Yes.
Are you finding with the additional patients you're seeing every week that is changing as you see more females come in?
Yeah, recently, so we have made more female patients come to here. So some of them are not so severe. Yeah, but compared to the male patient, the female patient want to treat in early stage.
Okay, in the early stages, that's good to hear.
Yeah.
So it's hopefully easier to treat when you're catching it early on.
I hope so, but...
You hope so, yeah? I was wondering, what are some of the difficulties that you face as a dermatologist, an associate professor, in Japan dealing with HS? Are there certain things that are very challenging?
So unfortunately, so the younger doctor know what is HS, but the older doctor don't know that. So many patients think it's an infectious disease. I don't know why, but the Japanese dermatologist new quinolone antibodies, not antibiotics.
Antibiotics.
It's very expensive and don't have any effect about the HS, but many dermatologists like that.
I see. I wondered, how much do cultural attitudes, like we had talked about females feeling ashamed or modest, do you feel like the attention to HS is helping overcome some of that? Or do you still feel like there's a lot of work to do to get especially females and males brave enough to come to you?
Yes, so in Japan, so female patients like to show the symptoms in the female doctor. But unfortunately, in Japan, HS specialists, there are no the few HS specialists of the female.
Okay, that's very enlightening.
But in Japan, so female doctor it's very difficult to work in the university hospital. Yeah.
Yes, okay. As you meet these different patients, do you find that there is a consistent treatment protocol based on the level of severity that you automatically try? So for example, when Jeremy was first diagnosed, it started with all topicals and clindamycin. I don't know if it's the same, minocycline, things like this. Then on to biologics. Do you have a standard method?
Yes. We have a standard, but it's a little bit old. So now we have a new weapons, so we have to update the algorithm of that.
What do you think, from your perspective, should be done within the medical community in Japan for dermatologists to help increase awareness further for HS? Is that a hard one?
I had to update the algorithm, guideline, because guideline is set in 5 years ago. Now we have new weapons that bimekizumab now, so I have to. Not I. We have to make new guidelines. Yeah.
This image is something Dr. Hayama put together to help convey the importance of treating HS early. Japanese culture is filled with anime and fantasy and also gamifying things. So we came up with this to try and appeal to the Japanese people's interests. On the left, you'll see the sorceress representing your doctor doing some magic on a baby dragon. The magic represents the first stage of medicines used to help keep HS at bay, like topicals and antibiotics, and the baby dragon represents HS itself. This is signifying that by treating HS in the earliest stages, you have a much better chance of keeping that baby dragon HS at bay. The next picture shows what happens when you don't seek help, allowing the baby dragon to grow into a full-blown, fire-breathing man-eater known as early stage 3. Now you're having to fight this unstoppable beast with much stronger magic, or shall we say, the biologics. But not only that, there's a new character on the scene. The swordsman that we see fighting alongside the sorceress represents the surgeon. When you allow this dragon to grow to early stage 3, that smaller magic will certainly no longer work, which is why you will need the new weapons you'll hear mentioned throughout this interview, the biologics that are available in Japan, like Bimzelx and Humira. So go in and get seen fast. Treat HS as early as possible. Now, back to the interview.
So that Bimzelx is the new weapon that you're partly using, and has that been very effective in your experience?
Yes. In the near future, we will have so many new weapons, but it's very difficult to choose the weapons because we don't know what kind of patient is good for the Humira or Bimzelx, or maybe so in the near future, upadacitinib or the BTK inhibitors. Many weapons. Many weapons,
which is a good thing, right? Part of the issue that we've experienced is that there is not a consistent treatment protocol, and that HS, unlike something like cancer, which once you're diagnosed, the doctor says, okay, we're going to do A, B, C, D. We don't have that in the States. Is it more formalized here in Japan? Do you have steps that you go through?
No, but the same as because we make the guideline, so we differ the European guideline. So first step is antibiotics, and the second step is change antibiotics, and the third step we use biologics. But now we don't have any evidence with which is good for the patient, or the Humira or the Binderex.
Thank you. That's very, very helpful. What are the most common misdiagnoses of patients with HS before getting diagnosed with HS? Do you experience people having specific?
Many patients, the doctor believe they have a very severe infection.
Okay. Which can be upsetting for the patient to hear oftentimes.
And they don't know how to treat them. But some patients use the internet or ChatGPT to find they are confusing because the doctor prescribes the antibiotics, but from the internet, maybe Chappie said your symptom is not infection. So patient is very confusing now.
I was reading one of the reports, I'm not sure if you authored it or contributed, but about how patients are going to social media to get diagnosis, and it looked like 51% of people go to Reddit, And I was looking through the different mediums by which they study. I think of it as an opportunity to help use those platforms to help us spread awareness. So things like that are very helpful. Thank you again for that kind of information. I also saw that in your paper, there is an average 8-year diagnosis timeline from when someone first gets a symptom. From your perspective, what can be done to help shorten that gap?
So it's very difficult to say, because in the clinics we can only use antibiotics.
Okay.
I hope we have a next weapon, to very easy to use in the clinics.
That will be wonderful. In terms of patient access to these weapons, like Bemzelix, for example?
Unfortunately for the Japanese patient, it's very easy to go to dermatologist. In Japan, there are too many dermatology clinics. In Tokyo, every station have every dermatology clinic. So it's very easy. Yes.
Okay.
Too many dermatology, but unfortunately for us, the younger doctor don't want to stay in the university to study some disease. They want to open their own
surgery
clinic.
Or something like that. Oh, open their own clinic.
Their own clinic.
Okay. That actually, it wasn't one of my questions, but it made me think what you said. Are there any activities being done within Japan to help get female doctors trained because of the desire to help bridge the cultural stigma, to get female Japanese doctors specifically studying HS to be dermatologists, so that they then can be available for patients, for female patients?
Because in Japan, there are few doctors want to stay in the university hospital, because the university hospital's salary is very low, so compared to the private doctors.
I understand.
So first of all, we have to increase the salary for the doctor in the university hospital.
There's a lot of steps. You know, one of the things I wanted to ask you about is the treatment and insurance, specifically in Japan. We have a lot of experience in navigating insurance in the States, and it's a nightmare for a lot of people. I wondered what the comparison here in Japan is for patients looking to get something like a Bemzelix or other weapons that they can be treated with. Are there any barriers to be able to get that through the insurance?
So in Japan, only the big hospital can use the Humira biologics, Binderex, because some doctors are afraid of the side effect. And in the small clinic, they can use the blood testing. At that time, they will defer to the big hospital like our hospital. And there are another problems. Biologics are too expensive.
Very. very expensive.
Very.
Is it hard to get approval through insurance to get that once they get into you at a university or a specialist?
So if the patient, the employee of the big company like a Sony or a Toyota or Nintendo, it's very easy to pay. But unfortunately, so most of the patients are very poor. So it's very difficult to get the biologics because many patients with HS, so like a blue collar worker, so like a taxi driver, or and they can't come to hospital so many times.
In that case, because that could be a very big demographic for you, what do you think the opportunities are there? What needs to happen in order to get those people, if it's such a big population? I'm sure it's multi-level steps, but is the first thing, for example, getting the local clinics educated on HS?
Many people in the such patient, the blue worker, like they like a gamble. So in Japan, so we have a gamble paper, newspaper. Maybe so make some article in the such paper.
So you're attracting where you know a lot of people are and targeting that. That's very smart.
Yeah, so for my opinion, so to make an article for the New York Times is not good because such a patient never read the New York Times. In Japan it's the same. So I recommend so drug company to make an article in such a paper.
The patients that you have and that you treat, how are you helping them manage the stigmas surrounding it, especially the females? Is that something that's normal as part of your care with them, or do you direct them elsewhere for that?
It's very difficult.
I bet.
Because many patients don't know we can treat it now. We have a new weapons. It's very difficult.
Very difficult.
Yeah.
We are lucky enough to interview a female patient next week with HS here in Japan.
Really?
And she's suffered very long time. Very, very terrible case. She has a lot of comorbidities associated, walks with a cane. And I can just imagine how difficult someone that has tried every treatment, but nothing is working. Do you have patients like that where you've tried everything, but nothing is working for them?
So some of my patients have very severe diabetes, or such a patient can't stop the smoking. It's very difficult to use, and also the patients are very poor, so they can't use the biologics. It's very difficult to help them.
That must be hard for you as a doctor because you see what is needed, but there's only a limit to how much you can do within the population.
I always recommend them to go to the internal medicine to treat their so diabetes and stop smoking, but they never do that.
It's interesting, in the US, there's so much conflicting information about smoking, obesity. I hear you say that. Are those common triggers that you're experiencing? I read the data, and it said there was kind of mixed reviews about smoking. And when we heard predominantly male, the first thing we thought was, is it because males smoke more? Is it because there's more hair follicles? I just don't know the answer to that. And I wondered, it sounds like smoking for you is a big trigger that is affecting your patients?
Yes. It's same as a Japanese patient.
People like us that are international advocates for HS, do you feel like the things that we're doing from a global perspective can help bridge the gaps? This is not a loaded question, but more along the lines of, are there regular people or patients that could do more to help the greater population?
Yes, I think so, but unfortunately, so Japanese people don't is not good at English, so it's very difficult. Maybe so poor people is not good for the English more. So we have to translate into the Japanese word.
And is there, that you're aware of, any command media, any readily available brochures or information that may be at local clinics, so that if a patient walked in and say had a cold, but they said, wow, I see that brochure, I have a bump that looks like that, just to raise awareness. Do things like that exist here that you're aware of? Those types of brochures or advertisements that people can see in clinics?
Yes, they will make it.
They will make it. Okay. But it's something that
now
you have.
we are making some paper for the clinic doctor to find the severe patient with HS, and what is a good timing for the to defer to the university hospital.
Okay.
Yeah.
That's good to know. Part of when we get this information through interviews is learning how we can better help the different populations we visit to ultimately, kind of like a puzzle, connect all the pieces.
Yeah.
We have,
I agree with you.
we run 3 brands under our business. One of them is music related, where we have a very large following. And I bring that up because as part of our advocacy, we mention these things talking about music, and the amount of comments that we get from people saying, I have that. I didn't know it was called that. So using everyday things like music to help be able to communicate is one of what we're looking forward to doing. So if we had someone in Japan say, I have that, or where should I go? What would be your suggestion on what's the first thing they should do? Other than me saying, call Dr. Hayama. Go see Dr. Hayama.
Yeah, but recently, people are searching some information from the internet, and I'm the first author of the Japanese guideline. So many people want to come here.
There's probably a big wait to
but
see you.
It's not good because we have to increase the specialists for the HS.
Are there more doctors in training to treat HS that you're aware of?
Yes, they are helping us.
Good.
Yeah, we are make an education webinar for the younger doctor.
Oh, good.
And I want to recruit them to to studying the HS.
That's really helpful to know, so thank you. I apologize if this is duplicative of what you two already know. We're learning as we go, and I'm grateful for that. The guidelines, you're based on European guidelines, and that's not very helpful for Japan, right? What else? No.
But many people, many specialists of the HS are reading that, so it's very helpful for us. But not for the patient, because it's too complicated, I think. Guidelines not for the patient, it's for the doctors.
In terms of learning as a doctor, your background, is there anything that specifically got you interested in studying HS specifically? Was it you had a patient and you wanted to go into that field directly? It's just so exciting to hear that someone has the interest and someone like you can communicate that to the future generations. There's a big opportunity to help.
Yeah.
But part of it, from what I hear you say, is just enticing those doctors, not just to be here at the university, perhaps lower pay, but private practices. Are there private practices that you know of that treat HS?
In Japan, to use biologics, we have to submit some approval from the Japanese Dermatology Association. Maybe it's a difference in the area. So in the local area, there are no hospital. There are some clinics in the local area. They are using some Binderex or Humira, but in the city area, it's very easy to defer patient to the big hospital. So at that time, they never use the biologics in their own clinic.
Okay. It just makes me think, as you say all of this, it's so helpful. Dr. Hayama, if you could please tell us one thing that you would like to share with the HS population around the world, please.
Now we have a new weapons, so we can treat the HS. Please come to the hospital as soon as possible before you become harass-free. Thank you.
thank you so much, Dr. Hayama. Arigato gozaimasu for your time. We're so thankful.
Welcome.
Are there any questions or things we could answer from both experience from our side or anything that you would like to know? If not now, please use us as a resource going forward. We would like to be able to be force multipliers to help you in any way possible.
Okay.
So thank you. Even if it's not right now, please realize that we're here for you. Any major thing that I missed about the treatment of HS?
Unfortunately, HS is not so famous now.
Yeah.
Maybe in the next 5 or 10 years, it will be changed. I hope so that we can treat the HS without any operation. Sorry, I forget to say, Japanese people don't like the operation because in Japan, so we can't take a longer pay time off. So patients don't want to take as operation for hospitalization in 1 or 2 weeks.
Wow. So given we have patients that are some very poor, perhaps can't come to the university, don't want to get surgery, what would be?
Yeah, it's very difficult if they come to our hospital. It means the income is decreasing.
Okay.
Yeah. So it's very difficult. So for some patients, I recommend them to take 生活保護って何て言うんですか?
Like Medicare in the United States or something, Medicaid, something like this.
Yeah, but
okay.
In Japan, so they are assumed to take such system.
Interesting. The female that we're going to interview next week, she's had over 10 surgeries so far. And it's going to be fascinating interviewing her after the opportunity to speak with you to learn about her experience as well. So thank you for helping inform us and for educating us as to how things are going here. Yeah. We're very grateful, especially late. We know that you'd like to get home to your family, although you work all the time. Hopefully you have enjoyed hearing Dr. Hayama because there's so much information to be learned globally about HS, both what is being done, what is available now, but hopefully you've also heard to get some hope that there's different weapons on the horizon that are coming to fruition. And thanks to people like Dr. Hayama's experienced work, we're getting one step closer. Thank you again.
Yeah, thank you very much.
Arigatou gozaimasu.